Hello, everyone. We are here today with fibroid specialist Dr. Danny Chan of the Fibroid Institute, and he has agreed to do a spotlight today. So we're going to ask him some questions that would be of interest to fibroid for women dealing with fibroids. So thank you for joining us, Dr. Chan.
Well, thank you for having me.
So let me just ask you, why did you decide to become a doctor, or kind of what personal or professional path brought you to this place?
Very early on, when I was a kid, and I remember I used to get sick or just not feel well, and I'd be taken to the doctor, no matter what it was, if it was a cold or whatever it was. I always remember feeling better after I left the doctor's office or feeling
Hmm.
reassured. So I always kept that with me, and I really wanted to give that feeling or be able to make somebody feel the way I felt after I went to the doctor. And that was really the seed that planted in my mind about wanting to be a doctor, and then I figured out I was good at science and math, and
Hmm.
that helped me as well, especially biology. So
Okay, great. And so that kind of started you on your path towards
yes,
where you are today.
that's right.
So, what do you think it is about you and your team that's different from other fibroid practices?
I think we started from very humble beginnings. So we're not a big corporation. We're very family oriented. We care about our patients. We treat our patients like they were family. So for the people that work for us and the people that are in the practice and the patients that we take, we're focused on one thing, and we're focused on making patients feel better because of fibroid disease. And we know that we're empathetic. A lot of us have worked in the hospital before. We know what that experience is like. We know what we don't want our patients to feel like when they go
Mhm.
through a certain procedure in the hospital. And we really take that wealth of experience and knowledge and really apply it to the patients that we treat at our practice.
Well, I'm sure the patients appreciate that. If you read reviews, you'll see that a lot of them do.
Yeah.
What do you think is what are you most proud of regarding Fibroid Institute's success, accomplishments, or the impact on fibroid patients?
I mean, I'm really proud of the awareness that we've actually generated in the community. I'm proud of the way we do our procedures, the way we treat our patients, the way we control pain, our unique ability to have pain control that's typically related to severe pain after the procedure to almost nothing for a
Mhm.
lot of our patients. And then I'm proud of the way we treat our patients. Like I said, we treat them like family. We treat them. They really get the personal touch, the personal interaction with the doctors, with all the providers in the practice that you would not normally get.
Yes, that is evident with what patients say. And how do you develop relationships with fibroid patients to assure them that you're on their side, you're part of their overall healthcare team? Like, what words of wisdom do you offer to the fibroid patients?
I really think that part of the journey or part of the physician patient relationship starts with listening and
Mhm.
really being able to listen to the patients and be empathetic and not have any judgments and just be a good listener to begin with,
Mhm.
and to really understand the anxieties and the potential, just everything that happens to a patient and with fibroid disease, and just understand that the patients are people and they have lives and they have anxieties related to medical procedures, and there's a lot of unknown. So just listening and being able to be empathetic.
Yes. A lot of patients say that you guys are advocates for them and they really appreciate it.
Yes.
So,
I mean, we make it a point for sure.
and what do you think are some of the biggest challenges you and your team face in terms of fibroid treatment or in terms of for the patients? What's their challenges?
The biggest challenges, that's a good question. I think patient access, patient education. Uh,
Mhm.
that's a big challenge. Some patients, that may think they're not a embolization candidate, patients that don't even get offered that treatment. Those are challenges for us just to be able to educate the public, educate the women with fibroid disease that there's a non-invasive option out there that's no matter what size necessarily their fibroids are, or the location of their fibroids, or there's a potential not minimally invasive option. You don't always have to have surgery. You can keep your female parts if you wanted to. At least having that option to be available to you to actually listen and be educated about the procedure. Those are the biggest challenges for us is
Yes.
patient awareness.
Yes, yes. And do you have a favorite fibroid patient success story? If you do, kind of, can you tell us about it? What happened in that case? Or
Uh,
any other cases you'd like to highlight about fibroid, patients with these kinds of issues?
um, Okay, that's a good question.
And we can come back to that.
Yeah,
Uh,
I
let's
mean, there's so many good cases, I think, and at the end of the day, it's really, how patients can really get their lives back and
right,
and live without pain, and live. That's one, and or just be able to feel normal and be able to not have bleeding or things that are really kind of taken away from their life. So
right.
that's just in general. I really don't necessarily have a specific story, because
Okay.
all our patients are important to us, and all the good results, they make me happy. So
That's a good answer.
I don't I don't
That's
have
a great answer.
I don't have one
Um,
specific.
do
you know
you have a like favorite quote or philosophy or mantra that you go by?
Yeah, I wrote this down because I always say it wrong. So but computer's not acting right. Hold up. Yeah. So, for me, listening is a big thing. Being kind, being humble, and then do unto others as you would have them do unto you. That
Hmm.
that's what I live by. You know,
Yes.
and it's very cliche in a way, but it's very applicable to being a good person, and not only a good doctor, but a good person.
Great. That's great. That's a good answer. And what are you most passionate about professionally? Like, what excites you about your job and your contributions?
I mean, I really have to go back to when I was a little kid,
Hmm.
being able to, number one, relate to patients. Number two is to have a good bedside manner in the sense of being able to explain things to patients in a way that makes them feel comfortable and makes them feel like they understand, and that I understand. Those are the most, like, so I'm passionate about just making patients feel comfortable and making them feel better.
Yes, that's very evident in what patients say about you. And what about personally? What are you passionate about personally? Do you have any outside hobbies or interests when you're not being a fibroid doctor?
uh I'm passionate about my family, my children. Love them. I'm passionate about youth sports, the way that youth sports shapes minds and bodies of children and youth, and being able to mold character through youth sports. I think.
Hmm.
Um, I'm also passionate about my faith and being a good person and having sort of like a higher power to answer to, and understanding that you know the calling that we're all called to is a part of a bigger plan.
That is very inspiring. And last question, is there anything else you want to share about yourself that can help patients get to know you and connect to you?
Um, I would just say that when you meet me, know that I um, understand what you're going through. I empathize, and I truly want to help. And and if I can't, I'll be honest with you.
Right. Okay. Well, Dr. Chan, Dr. Danny Chan of the Fibroid Institute, Texas, and fibroid specialist, thank you so much for participating in this interview today, and we appreciate all that you do.
Well, thank you very much for having me.